Hi, it's Kathy Kress again, and I am back with my YouTube channel, Geriatric Care 1, and we are doing the new playlist, Caregiver Assessment. And I'm going over, and you can look at there are 3 episodes already out there. Why should you do a caregiver assessment as a geriatric care manager? What do you get out of it? And what does the caregiver get out of it? I guess we'll start there. Now let's start with you. What you get out of it basically is you can see how the whole family system is operating because the family is taking care, and basically you can help them and give them a voice. A voice. The caregiver can't be an anonymous person. The family caregiver is not an anonymous person. They need a voice, and you're going to ask them some questions, and they're going to be able to say, well, this hurts and that hurts. This is a problem. You're letting them talk, and nobody's ever probably done that. Because most family members do it they don't think of themselves as caregivers. They think of themselves as daughters. They think of themselves as wives. I, took care of my own dad for 20 years. I wasn't doing it because I thought I was a caregiver. I'm doing this YouTube. I was doing it because I was his daughter, and he was my dad. And so what do they get out of it more? It legitimizes to a caregiver that they have needs and somebody's listening. And it makes them really distinct from the care receiver, their mother or father or their husband, that, they actually have a voice. And, you're not just coming in to see and just, go off in the other room, you care receiver, caregiver, you're seeing the whole picture. And it's the first step in treating depression. It's the first step in avoiding depression. It's the first step that you take to understand how you can teach them their job. Essentially, does anybody have a family caregiver school? No. Do you have a family caregiver school in your agency? Probably not. You train your paid caregivers. Do you train those family caregivers? You don't. They need a job description, and they need to be trained. It's their first step then, and when you train them, and you can do it basically just by visiting and explaining things, they understand they have a job description. Who knew these things? They just got thrown into it. Their husband went into the hospital and he was fine. He came out, he's bedbound. Did anybody teach them exactly how to turn somebody? Probably not. It's their first step in understanding the skills that it takes or the skills they don't have, so that you may, and they understand that, have to hire a private caregiver. Because, when their 87-year-old wife, can they really be turning their husband? They have bad backs. And it's the first time that caregivers really understand the lost time that they really have with their primary family. And this really, this applies to daughters. Because daughters are, and I was doing this, I'm not trying to make myself out of a martyr, I was at a job, I was a geriatric care manager, I had a teenage daughter, I had an older daughter, grandchildren, a husband, all these things, plus my dad. And, and I'm really lucky, I knew what I was doing, and I had a paid caregiver, but I wanted somebody to acknowledge the lost time that I had lost with the other people I was supposed to be taking care of. I was in a really good spot. These unpaid family caregivers aren't. And it's the first step that the unpaid caregiver has in understanding there's a whole community services resource to them. They don't have to be alone. There is Meals on Wheels. There are, there are paid caregivers. There's all these things that can help them. Help is on the way. So, who should assess this family caregiver? You, the geriatric care manager. See you next time. Go to my website, kathykress.com. I blog along with this, and see you in the next episode.